You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We've had him on the program before. He has a lot to say. He is New England's go-to implant dentist, Dr. Jason Tubo. Dr. Tubo, welcome back to the program.
It's good to be back.
Now, every time you come here, you have a stack of before and after photos.
I do, yeah.
And these are pretty dramatic today, so we'll get to as many of those as possible.
Sure, yeah.
Now, and for people that don't know, because look, you've been on the program several times over many years.
Right.
Like, what's changed? Because we were talking on the phone, you say a lot has changed. What's changed?
You know, I mean, we have, it's the usual when I come back on the program after a couple of years. There's some updates in the technology, and, you know, we've expanded what we're milling and what we're doing in the laboratory, but, you know,
milling
really,
meaning you're making the teeth, right?
We
there.
make everything from start to finish.
Okay.
What every other dentist, you know, they make part of that in their office and they send the rest out to their external lab. We have built into our practice that lab that most dentists send their cases to.
Okay, so other dentists actually use your
They do, in fact, yes.
lab to make teeth.
So
okay.
We have other dentists all throughout New England that send their dental work to be made by my technicians because they know I'm very fussy and particular about the details, and
okay.
I'm the control freak, and so I don't have to wait for things to come back and forth in the mail.
Is that why you do it so quickly? Like, because look, we talked to the green room. You said, look, you'd have to have an opening in your schedule. Correct me if I'm wrong. If you met somebody today, tomorrow they could have their new upper and lower teeth that don't come out supported by dental implants.
If we have time for each other, absolutely.
Has that ever happened? Like in 24 hours?
It has happened nearly a dozen times. I think it's about 11 times we've actually done that, where it's been 24 to 48 hours after we've met. We've actually sent someone home with teeth out, implants in, new teeth on implants, less than 2 days after we met.
Okay, good. And correct me if I'm wrong, the way it's typically done still is when you're talking about dental implants,
right?
You go to one doctor that does like the surgery or does the implants, another office that puts the teeth on top, and then another place that cleans them. You do all three parts.
We do everything all in one place, yes. And so if we need a specialist, for example, if we're doing general anesthesia, I have my anesthesiologist who we bring into the practice. So it's not just one doctor doing everything, but it is myself and my team of doctors doing that all in one place, so that you're not traveling to different offices and getting different quotes and different prices and trying to figure out what does it all mean in the end. And we try to eliminate the surprises along the way as well. You know, you asked what's changed since the last time, and really one of the biggest things that's changed is I have a deeper appreciation and understanding for the impact that a nice smile has on the person over the course of a decade. You know, and so when there was a younger version of me coming on the show once upon a time, right? You know, I couldn't say that I had 10 years of follow-up under our belt. You know, now we're looking at some of these clients 10, 15 years later, and I get to see the transformation in their life and in their family and in their friendships, just because they're not thinking about their teeth anymore. They're just smiling and enjoying life, and they are that it's not front of mind anymore.
Well, what do they like more? How it looks or what they can eat and chew?
Both. You know what I think people like the most is that they don't have to think about what am I going to eat, and they don't have to think about how I look. They just like how they look, and they can eat whatever they want, as long as it's food.
Now, what about the typical dental implant patient that you see in your office?
We have two main categories of the typical patient. One is one who's been in dentures, they don't have teeth, maybe they've been told that they're not a candidate for dental implants. I hear that every single day. Somebody who comes in and tells me, I was told 10 years ago I couldn't have dental implants. My team...
Why?
Well, some of it has to do with maybe the technology available at the time. Some of it may have to do with the expertise of the doctor who is giving that opinion once upon a time as well. But we can do amazing things. It's almost magical. We can work with smaller amounts of bone. We can grow bone if we don't have the bone. And we can do this in very rapid, very predictable ways, so that we're not waiting 6 months or a year or 2 years from where somebody is with maybe dentures to finally having permanent teeth on implants. And again, I hear that almost every single week. Somebody who comes in and they're still being told it's going to take about 1 or 2 years before we can actually put teeth.
But it is true. I mean, if you've been wearing a denture like 10, 20 years, you can't do this. You don't have enough bone, or because of your lack of bone, it may take 2 years.
No, that's the old way of thinking. That's very commonly said. I know people are hearing this, but it's not true at all.
Is it just based on the doctor's experience?
based on the doctor's experience. There are some shorter implants that we can use in sort of tighter spaces. And so we have specialized implants today for patients who have little or no bone. In fact, in our practice, we call it a fixed on-zip. It's the ZYP is the abbreviation for the bone that the implants go into, and on-zip is like on nothing, right? So it's the fixed on-zip.
Now, what about the snap-in dentures? We talked, you're not a big fan of those. It's a big trend here in California. A lot of the newer progressive dentists are doing these.
Sure.
What are your thoughts? Because
I think you're going to be far more likely to find newer dentists who are doing those procedures. Back when I was a newer dentist, I did some of those procedures. I think if you have any dentist who's maybe done 40 or 50 of these snap-in dentures, what I say in my practice all the time, this is still an expensive procedure. You're placing multiple implants, you're doing a prosthesis, and the thing is that it's still removable teeth. Patients don't like it in the end. Doctors, we've invested a lot of time in that. I say all the time, it's too much money and it's not enough happy. It's not worth it. It's not worth it. Patients don't like it in the end. The doctors don't like having done it in the end. So it's
still a denture?
And it is still a denture. It's a denture that clicks onto implants. It's better than a denture with no implants, but you're more than halfway the way to the cost of doing permanent.
So you say in the long run it's more expensive, these snap-ins. How could that be?
In the long run, absolutely. You're looking at long-term expenses of maintenance of these implants. You're looking at having to replace that prosthetic, replacing the denture. They're more prone to breaking. They're not as strong.
Snap-in dentures.
Snap-in dentures. Yep. They do a lot of. They actually do damage. They fatigue the tissue around those implants because that implant, we're putting something on it and taking it off, and putting it on and taking it off, and so we're putting that implant through a lot of trauma over the course of 5-7 years. It's not the same implant anymore. Totally different universe when we're actually putting permanent teeth on implants, connecting everything together. These don't budge. These don't move. Patients like them, but then 10 years later, they still look good and they're still rock solid.
What's your oldest patient? How old can you be to do this?
Oh, my
to
oldest.
Get new teeth.
My oldest patient, that I did a full arch on. Let's see, he was 95 actually when we did it, or 94 when we did his.
Aren't they more likely to fall out if you're that age? The implants?
No, not at all. So age is not something that affects whether or not implants are going to work for you. I know that's kind of a common misconception.
We were talking in the green room. I said, you're changing people's lives. You say it's them.
Correct.
Elaborate.
Yeah. And so, it's not me that's changing their lives. I say a lot. It's when that patient has made the decision, I'm finally going to call. And a lot of times these are people that they tell me, Dr. Tubo, I've seen you on Randy's show for years. I've been watching that. Maybe I've seen the reality show, or I follow you on your Instagram. I've been really watching. I've seen these before and afters. I've been putting it off for 3 years, 4 years, 7 or 8 years. And then I finally mustered up the courage to call. All of my patients, everyone that I have pictures here, these are all researchers. They are those that it took a while for them to find the right place. They interviewed a number of doctors. Some of them were skeptics about what could be done because they had heard lots of different ideas and stories. When we bring them in, we show them this is what we can do. And I tell my patients all the time that I understand there is this side of this where you don't know until I get you to the other side that I really am telling you the truth.
But by the way, are you ever on a consult with a patient and they're giving you their hard luck story about their bad teeth and gums or whatever, and they've decided to move forward? Do you ever think they have no idea how good this is going to be?
All the time. It is hard to understand. If you've gone through a long time, or a lifetime of just bad teeth, whether it's bacterial infections or whether it's related to medications in the past, whether it's who knows what could be the cause for someone to have bad teeth or an unfortunate appearance to their smile. So when my patients finally, when they muster up that courage and they say, I've been watching a long time, it's time to actually pick up the phone and to make the call and to get scheduled to at least have a consultation and see what's going on. Universally, my patients will say, I can't believe I waited so long. I shouldn't have. I have.
You think
I have
they
regrets.
lost out on good years?
They definitely did, and they know that. And sometimes that can feel sad, but I tell them, I'm glad you're here now, and it's not another 5 years from now because you made the decision to call now, and you don't have to kick yourself because you didn't do it 5 years ago. I'm glad it's not 5 years from now.
Good for you. You have photos. What are we looking at?
Yeah. Actually, Rick he's a great example here.
And by the way, all of these people could have had a denture, a traditional denture.
Absolutely.
And they didn't want it. Okay.
Right. And so Rick, he was he was a skeptic. He came in, he was told that he wasn't a good candidate for placing implants. He was going to have to go through about 18 months of sort of some surgery, some procedures to get ready for implants.
Bone grafting kind of stuff?
Bone grafting. The teeth were going to have to come out. He was going to have to be in a denture for at least a year.
So he was like a second opinion going to you?
He was. I think I was about the fourth opinion coming to me. And what was unique is that Rick said that I was the only doctor out of all of these opinions that said, we can do your procedure as soon as we can make time for each other. So if that was tomorrow, I'm ready for you. Where I measure things now, for me, it's a little bit like cheating because I have these 3D X-rays and they give me very high resolution images, and I have my laboratory and I can do all of this digital planning and design right there live, and I can make and 3D print parts immediately, right around the corner in my laboratory here. And so I can turn things around faster than,
so when you told him you could do it right away, he's skeptical still.
He was, and he said it was hard for him to sort of process. Why are you saying that when the majority of doctors are saying that's not possible, or I have to spend time in a denture? And Rick was one that we really had to sort of pause, and we 3D printed a trial smile for
like
Rick.
A set of teeth?
There's a set of
teeth
teeth
can know what it looks
that
like?
just kind of went over his broken teeth so he could see what it would look like.
What
so
does
that he was amazed. It looked like it was done, and we hadn't even done anything yet.
Okay.
And so Rick was still a little bit skeptical, and I told him, until we get you to the end of procedure day, right? Until we get you to the afternoon and you have teeth to take home, I understand why you find that hard to believe, but I do want you to trust me, and it's my job to prove to you, and we're going to show you.
Okay.
And now, Rick is a
Let's
crusader for the
him?
practice. So yeah, here he is. He's a handsome guy, and he works in the entertainment industry.
Looks much friendlier in the after
does,
photo.
Yeah, he looks more educated. He looks more approachable. He's he looks nicer. Rick's a super nice guy. He was a nice guy with broken teeth, but he looks like a nice guy with a nice smile.
So could they eat things like, once they're all healed up, like beef jerky or like almonds or whatever? So there's no restrictions?
There's no restrictions. And so the answer to that is yes. And I tell my patients, as long as it's food, you can eat it, right? So if you could eat it with the teeth that God gave you, you can eat it with the teeth that I made you.
Okay, good.
So here's another patient. This is an interesting story. And she had some history, some medication, some substances that contributed to, drying of the gums and the teeth and losing most or all of her back teeth. She had a lot of cavities. She's very young. She's a mom, but she can't eat normal food. She can't eat a salad, can't eat the things that we just take for granted when we have teeth that work.
Salad seems like it'd be an easy one. Those are tough.
Salad is actually one of the hardest things to eat when your back teeth don't work because it's so thin and papery. It's really, really hard. So to be able to eat salad normally, we have to have your bite dialed in so perfectly. And that's one of the things that I see when maybe other dentists might kind of miss the mark, or someone's wearing dentures and they say, my dentures move around and I can't eat salad. It's one of those things. Now, if you don't like salad, you don't have to eat salad, but you can eat whatever you like to eat with the teeth that I make for you. I promise you that if Mickey had gone to most other offices, they would have given her a denture and they would have told her that's the best you can have. That's all that's possible.
Young people have dentures?
Lots.
It's common?
It is common. It doesn't need to be. And it's a lot of times we associate, young people don't, or that older people do have dentures, but there's no such thing as a 99-year-old who should have a denture either. They can get rid of their denture too. So
what'd you do for her?
So with Mickey, we gave her permanent teeth on the upper and the lower, rebuilt her smile.
Looks good.
And she restored her own confidence, but by trusting us to do this, her confidence was built back. Mickey has an amazing story. This was against, my advice. I didn't know about this, but 22 hours after we did the procedure, the big day. And I tell everyone, go home, take it easy for 2 days, 3 days. You have every excuse to sit on the couch, watch some Netflix, have your husband, make dinner and take care of the kids or do whatever. 22 hours after we do the procedure, Mickey goes and interviews for a job because she's feeling so good and so confident. And it's a job that she was maybe not going to go for because, she was a little embarrassed and ashamed of what she had before. She got the job and she got a huge raise that in hindsight, we look back and
she calls you about and tells you?
Oh yeah, told me about it almost like it was like confession. She was telling me I need to confess. I didn't just take it easy and stay at home. I actually interviewed for a job.
Got it.
She had like a little bit of swelling, and she had to just explain it, right? Just the tiniest bit, but she got the job, got a raise, and so a lot of times my patients ask me, how can I afford this, or how am I going to be able to pay for this, or to figure that out? We have financing options and things like that.
Because Medicare, Medicaid, I mean, dental insurance doesn't really cover this.
No.
You say people are financing this a lot?
There's a lot of financing, yes. Okay. We work with several third-party financiers. It's the same as when
you have to have okay credit, though, right?
For the most part, yes. The better the credit, you can get cosigners, okay. Yes. Yep. The better your credit, the better your terms. It's the same as if you're going to go buy a brand new car, right? Most people aren't going to bring a briefcase full of money in to buy a brand new car. Some people do, that's fine. For the majority of us that do not, we're going to set up some sort of terms, and we're going to set up financing payments. Yeah.
And on that after, they do look natural. And I'm not trying to side with you, but they do look natural.
Well, they do, and that's by design, that's by intention. And so every smile that we make is tailored and customized to the individual person's facial features, their bone structure. You look at her smile before. It's shadowy. You can see that we're missing these teeth.
Like the corners of the mouth are dark.
Very, very dark and shadowy there in the corners. It makes things look kind of small and tucked in, almost mousy, is what we would say, right? And you'll see people who have dentures and they've had dentistry done, and they look like that also, right? And that's after they've been restored. Now we're very, very careful, and I'm a little obsessive about these details, right? And that's part of what brings people to find me when they're doing their research, and they say, I want to see the guy that is really paying attention to all of the details from the surgery to the finals, right? And everything in between. And so when you look at, it's not just the brightness of her teeth. You look at how the lines follow the lip, the upper lip, the lower lip. It's not shadowy, it's not dark in the corner.
Is this done on a computer to make the smile fit her face?
Yeah, and so this is done in a computer. So we do 3D photos, we do 3D x-rays, we then do other 3D optical scans. We combine all of this three-dimensional information together so that I have a virtual you
and then they make it in my computer.
Room. And we make it in the next room. And I have a lot of patients who, they're interested, they're curious, and so, sometimes at their first consult, because they want to see it, or they just want to, we'll give you a tour of the laboratory. The technicians, they're all nice people. They love what they do also. And so I have a handful of patients that, they take an interest in seeing, how the printers work, how the mills work. And, you can open up that door to the lab at any time and you're going to see smiles being made all around you. It's pretty interesting.
Now we're short on time, so I'm going to rush you, and I know you want to get through all these photos.
So we have Deb. Deb is one. She came to us, also did a lot of research, finally found my practice, had our consult. We had her date booked, I think, from that first meeting. We went ahead and she said, this is definitely the right place for me. She was very concerned about pain. She had a lot of pain. She had some looseness to her teeth, some periodontal gum disease problems that were going on there as well. And just the discoloration and the misalignment of the teeth.
Is that unusual to see teeth like that?
It's unusual to see teeth like that, but it's not unusual that there are teeth like that all around us. And the reason why is that when someone doesn't have nice teeth, they don't smile. And so one of the things that I have patients all the time, they're worried about when I do this, when I do the big change here, when we redo my smile, right? Is it going to be shocking to my friends and my family, my coworkers? Are they all going to notice and they're going to say something and make a scene? And routinely, now we see the dramatic change in difference because we designed, and here, take a look at how Deb turned out. So we see this big change, right? But I find my patients, they say all the time, they go, it's like nobody at the office even noticed. Or, I had somebody, it was like even her cousin who'd known her for 50 plus years said something like, are you sleeping better? Or did you change your hair?
Just because they never saw their teeth before.
Because they weren't smiling. So they didn't know it was so bad because they were reserved. All they see is now that there's a bright, happy, more open person. The personality
what
is
got
out.
Into her? Why is she smiling all the time?
Right. You know, it's why is she so happy? You know, and it doesn't upset anybody at all. It's everyone around you. It's magnetic, right? You know, it's that it opens up your personality. We see things like Mickey's story, right? You know, it opens up the opportunity to get a different job, you know, to go for the interview that you otherwise might not have, and to further your life, your income. I want you to look at Deb's after there.
Okay.
She's not smiling all the way in that picture. And part of that is because she hasn't smiled fully in so long that the muscles haven't really been used and exercised yet. You know, she gets 10, 11, 12 more compliments, right? And you're going to see that smile open up so much more. And then those muscles really start getting, and we see that smile go from here to a couple months later, even bigger. I don't have to do a thing.
I want to make this clear. So if somebody's watching this, bleeding gums, bad breath, loose teeth, or even wearing a denture, if you had openings in the schedule, but by the end of this week, they could have their new teeth. Is that correct?
Correct. As long as you're...
Not an exaggeration.
Not an exaggeration at all. As long as we have time for each other.
Okay.
It's not often that I have a surgical slot available this week, but a consult we can see you for right away.
Are they always in a hurry? Once they decide to move forward, they're going, how soon can I get this done?
A lot of people are. You know, I think that once they see the possibilities, they get it. Once they meet my team, they see the technology, because it's obvious once you're present in it and you see what's happening. You know, if you walk into the laboratory and you see so many smiles being made all around you, it clicks.
When it comes to Southern New England,
it actually happens.
I'm going to put you on the spot. In Southern New England,
yeah,
would you say you're practicing at the highest level?
Absolutely, we're practicing at the highest level. That is the definition
and
of my
this is your focus, implants.
Correct.
That's your focus. Yeah. Okay, I'm going to rush you with I want to get through these
absolutely.
photos.
Nancy's a great one. So Nancy is one here. She started it in a denture when I met her.
Those teeth look pretty good.
Well, she didn't like them. They can look good to you, but you know, Nancy
like,
didn't like
that.
Complaints? They looked a little too long, and I see that. You know, there's just a lot of upper teeth there. They're bulky because a denture has to have that flange that goes up and around the ridge and under the lip. So remember, it's a big suction cup. It doesn't just go where the teeth go. It goes everywhere out and around and beyond. That's why people hate them. And yeah, you can see Nancy she was in a denture. And she wanted something permanent. She wanted to be able to eat with that denture. She couldn't eat normally. The brightest, bubbliest, most wonderful personality.
Okay.
And needed the smile to go with it. And I really think we nailed it with her.
Oh yeah.
And
much different.
You see all those details again. The arc of the teeth follow the lips. It's not too much shadow. It doesn't look like chiclets going all the way across. You know, the piano key effect of everything going too wide across the smile.
So you're a perfectionist when it comes to this.
Yes.
We have about 2 minutes left.
Sure.
What is the process to getting your new teeth? Like, what are the steps?
Right. It starts with making that phone call. So stop watching me for years. Stop watching the videos and thinking, you know, maybe I should call. But just pick up the phone, make that call. Come in for a consultation. We're going to take a look at everything.
Okay.
We're going to do a 3D X-ray. I'll tell you if you're a candidate. We're going to find out that day. Okay. Almost certain 99% chance you're a candidate. We'll go over the different options that are available to you. You know, how do you want things to look in the end, right? How do you want it to feel? How do you want it to work? Do we have a deadline? You know, is there a wedding coming up in a couple of months that you think there's no way I could get this done in time for the party, for the wedding? You know, I can't tell you how many people come in. My daughter's getting married in 3 weeks, and I should have called you a year ago, and we'll make magic happen if we can. So that consultation, that's that first step. The next step, that second visit is going to be the procedure day. That's, you know, sort of everyone's favorite day. It seems like it should be the most expensive, but you know, it's actually not. The most expensive part of this is when it's all said and done, and now you have these beautiful teeth, is how much money you're going to spend on going out to eat.
Going out to eat all the time.
Yeah, you're going out with your friends. You're going out. You know, you feel great. You know, you're buying around for everybody else too. You know, you're not staying at home because you're ashamed of how things look. You know, you're going to be out and. When
it's all done, do they always say, I don't want to put words in your mouth, but this was a lot easier than I thought it was going to be? Meaning they're always worried about pain and downtime and all those things.
Yeah, I have a lot of
patients. You hear that a lot?
A lot. They're worried about pain. And I mean, we worry about that for you, right? And so we've come up with ways to manage that, to keep that minimal. The vast majority of our clients say immediately, that was not as bad as what I thought it was going to be. That was so much more doable. I look back, I feel bad because I was so scared for so long, and I feel like I lost those years. And again, you won't know until I get you to the other side of it. And then you know, because now you've experienced it. But then it becomes your job. You got to let other people know, right? Because there are other people that are worried about this, that want to have this done. And the beauty of that now, so many implants, so many smiles done, so many years under my belt. You can go to my Instagram and you can see videos of real people, the day after surgery, a week after surgery.
Some of them.
Some of them very immediate. Some of them are actually the day of seeing it, the reveal for the first time. You see, they're happy. They're not having a bad day. They're having a good day.
Why is it? You said something earlier, and I want to make sure I understood you correctly. You said like minimal or no bone grafting, and I've interviewed dentists, and like the bone grafting is a big part of the conversation I have.
Yeah.
And you're saying with advanced techniques, it's not necessary.
Right. And so
is that true?
It is true. And so there is a time and a place for bone grafting where we will sometimes need to employ that. It's 1 or 2% of the time. So if you have a dentist who's telling you that you need extensive bone grafting before implants can be done, you're more than likely seeing a less experienced dentist. Bone grafting is one of those procedures. It's the first procedure that's taught in these types of procedures. And so it starts with, before you place your first implant, you need to learn how to do bone grafting.
Is it expensive to go through all that bone grafting?
It is, yeah. So it's expensive in time. There's a
dollar
dollar
cost
to it, for sure.
It's not necessary in most cases?
In most cases, it's not necessary when we're doing full mouth, full arch. Sometimes it is a little more necessary if we're doing like that one tooth pretty implant, and every little speck and detail matters about the shape of the tissue in the bone. But with these types of treatments, when we're doing permanent teeth on implants, it's very rare that we rely on bone grafting.
And people travel from all over
to
see you?
People that fly in from all around the country to come see us.
And 3 offices.
3 offices,
and,
yes.
Are
all around New England.
All the dentists you work with, do they have the same perfectionistic philosophy and approach about them?
They do, yeah. I'm very fortunate to have amazing professionals and specialists who I work with in my practices. They are very fussy and very picky. We spend a lot of time in those early years calibrating so that we see things the same way, think the same way, plan the same way, so that if you see me or you see one of my associates, you're very much hearing the same message. Very different from if you go to another, you get 3 different opinions, 3 different offices. You get sometimes some very, very wildly different ideas. We've worked hard to calibrate good decision-making, good options, and so that you hear that in repetition, you say, this makes sense, because they know what they're talking about.
All right, Dr. Tubo, we're completely out of time. If they want to make an appointment, do they go schedule online, like on your website, or just call your office? What do you prefer?
Either, whichever is most convenient. So you can schedule from the website, fixtdental.com, or call the office.
All right, well, thank you for coming on the show. Good stuff.
My pleasure. Thanks for having me again.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.